Tooth fillings vary in longevity, strength, cost, color, ease of placement, length of time to place them, and frankly, overall patient satisfaction. Silver fillings are by far the most commonly used dental restorations around the world. However, tooth-colored resin fillings are becoming more popular, and their acceptability and usefulness is documented by research. Gold fillings, well proven to provide long-term service, can be placed by skilled clinicians to provide aesthetic acceptability, although you wouldn't think so. But some patients object to the occasional display of gold in their mouths. Tooth-colored inlays and onlays, made from either ceramic or resin material, are beautiful and can provide excellent service, especially when teeth require moderate-sized restorations but are not large enough to require a cap or a crown. However, some dentists do not provide these restorations. You and your dentist must decide which type of restoration is best for you, depending on which characteristics you prefer for your own tooth restorations. When tooth fillings are adequately placed, they don't feel any different than unfilled teeth. They serve well and preserve your natural dentition. But, as you might expect, fillings wear out and may need replacement in the years to come. Usually, your dentist will use a local anesthetic. This procedure is normally painless. Fillings require removal of not only the decay, but just a very slight amount of non-diseased tooth structure. 1 or 2 appointments are needed for typical fillings, depending on whether the dentist or a laboratory technician makes the tooth restoration. What are your alternatives? You have 4 alternatives to consider when determining what type of restoration you would like for your posterior or back teeth. There are several characteristics that you must consider. How about the color of the restoration? You may range from tooth-colored to gold to silver. And longevity. Several of the restorations, including silver amalgam, resin, and ceramic or resin inlays and onlays, serve for several years, while gold inlays and onlays will serve for many years. And the strength varies. It ranges from weaker than tooth for silver amalgam, resin, and inlays to stronger than tooth for onlays, whether they're tooth-colored or gold. The cost varies significantly as well. It's relatively inexpensive for some restorations, such as silver, to 5 or 6 times the lowest cost for other types of restorations. The following discussion is divided into 4 sections, one on each of the types of tooth fillings available today. It will provide information necessary for you to make a decision about the type of tooth filling you prefer. Silver fillings do not look like a tooth. However, resin fillings can look exactly like tooth structure. They may strengthen tooth. There is a necessity to remove only a slight amount of tooth, and only 1 appointment is necessary when it's moderate sized. There is comparable longevity with silver amalgam restorations obtainable from resin restorations. But what are the disadvantages? Resin restorations must be placed well. They should not be used in large cavities. And there are a few risks. Sometimes they cause slight temporary tooth sensitivity, but it usually goes away quite rapidly. The cost of resin restorations is usually slightly higher than silver fillings, but not always. Silver amalgam has been used for over 175 years. It has moderate longevity, and its effectiveness is well proven. Disadvantages: it's not aesthetically pleasing, and it can darken surrounding tooth structure. Are there risks? Silver amalgam contains at least silver, tin, copper, zinc, and mercury. The mercury is chemically bound and stated to be innocuous by the World Health Organization. But the potential for these metals to be allergenic or toxic is challenged by a few dentists and organizations. The cost of silver amalgam is usually the least expensive of all tooth restorations. What is an inlay or an onlay? These tooth restorations may require 2 appointments if made by a dental laboratory, or 1 appointment is made in the dental office. They are made outside of the mouth and cemented into your mouth. Whether they are gold or tooth colored, an inlay filling does not cover the entire chewing surface. An onlay, however, covers the entire chewing surface, providing more strength than the inlay. Gold inlays or onlays are the longest lasting restoration dentistry has to offer. The wear of gold alloys is similar to tooth structure. They don't wear opposing teeth, and they can strengthen a broken down tooth. But they're gold color. As you observe this image, you will see the beginning of the treatment. Then the old silver fillings looking from the top surface. You'll see how many gold fillings have been placed, but look at the front of that mouth. You don't see much gold display at all. In other words, you can hide the display of gold. Are there risks? None are known, except a very small percentage of patients may have allergies to the gold, silver, palladium, platinum, copper, or other elements used in the restorations. But the cost is higher than all other small restorations. The defective silver filling you are observing will be replaced with a beautiful ceramic onlay. Are there advantages to this onlay? Well, it's tooth colored. It can strengthen tooth. These restorations have little or no allergenic or toxic potential in humans. But there are some disadvantages. It's usually 2 appointments, except 1 for some dentists who have an in-office computer milling device. And what about risks? They can cause slight post-operative tooth sensitivity that usually goes away soon. And if you happen to chew something really hard, you could break one of them. The cost is similar to gold. It's more costly than silver amalgam or tooth-colored resin by several times. Now you've seen the alternatives. You must decide what tooth restoration characteristics are important to you. Color, longevity, cost, time in the dental office, or other. The tooth restorations available today are the best in the history of dentistry. Talk to your dentist to assist in making your decision. Resin tooth colored, it's beautiful, relatively long lasting, low to moderate cost, and these restorations can strengthen a tooth. Silver amalgam, it's long proven, relatively inexpensive, but it can be unsightly. And they can discolor your tooth. The biocompatibility of amalgam is also under scrutiny by a few. Gold inlays and onlays are the longest lasting. The wear of both the inlay, onlay, and the tooth is lower. These are higher cost, however, and they're gold colored. Ceramic inlays and onlays are beautiful, strong, very biocompatible, but they're higher cost. Now, you make the choice.